Question. I recognize the Leader of the Third Party.
Thank you very much, Speaker. My question is for the Premier. Right now in Ontario, there are 1,243 cases of the measles, which far outpaces, by the way, all of the United States. All of the United States. Twice as much as Texas, that has twice the population. It's the worst outbreak in 3 decades. So maybe the government doesn't realize it, but it's a serious situation, and we didn't have to be here. So we got to ask ourselves, how the heck did we get here? So, to the Premier, why is the Premier failing to protect Ontario's children from the measles?
The member for Essex for a response.
Speaker, of course, the measles vaccine is readily available in the province of Ontario. Anybody can get the measles vaccine. It is commonly referred to as the MMR, measles, mumps, and rubella vaccine. It has been around for over 50 years. It is proven and it is effective. We encourage everyone to get the measles vaccine, but especially children, especially young children. The vaccine is free. You can get it anywhere in the province of Ontario, and it is especially made free because we fund our public health units. We've increased funding to the public health units by approximately 20%, and that is one of the reasons why we promote the vaccine and want to promote the vaccine, especially for children and especially for young children, because we want to protect our children from getting the measles, and we want them to be healthy and good. Thank you, Madam Speaker.
Answer the Leader of the Third Party.
I'm tempted to send that member some iron, because that's the most anemic response I've heard to something in this place. So measles is a childhood disease that has very serious consequences for children. And that's why we worked for decades and decades to get vaccination rates up. And guess what? We eradicated it. Guess what again? It's back. So right now, just like Nero played the fiddle while Rome was burning, the Premier is playing the fiddle while measles are burning through Ontario. Speaker, we all knew that childhood vaccinations after the pandemic would be a challenge. So my question is, why has the Premier failed to do what he needed to do to protect Ontario's children from the measles?
I recognize the member for Essex.
Thank you, Speaker. Of course, the funding for the public health units, which has increased by approximately 20%, is specifically made in order to assist for the delivery of such services as the measles vaccine. Of course, unfortunately, the Liberal Party voted against that funding because they voted against the budget that provided that funding. But we believe in providing that funding, Speaker, as we believe in providing the measles vaccine free for everybody across the province of Ontario. And this is a tried and true vaccine. It has been used for over 50 years. It is effective. When children get the vaccine, they are 99% protected against the possibility of contracting this disease. It is very important for people to become vaccinated. We understand that some families fell behind their schedule as a result of the pandemic, but it is definitely important to catch up and get your vaccine. Thank you.
Answer the Leader of the Third Party.
You cut public health funding by hundreds of millions of dollars. And the fact is, right now, you're not giving families the tools that they need, the information that they need, the help that they need. That's an embarrassing answer. So we know that 3/4 of measles patients are under 17. And most of those people, most of those children, are unvaccinated, the vast majority of them. And we know that any drop in vaccination rates is a risk because measles is so infectious. So, respectfully to the member across, the current situation was foreseeable and preventable. So I'm going to ask you once again, why is the Premier failing to protect Ontario's children from the measles?
I'll remind members to direct their questions through the Speaker. Back to the member for Essex.
Speaker, thank you. Again, it's unfortunate that the Liberals voted against the budget, which provided the increased funding to public health units, because that was an increase of over 20% since this government has taken office. It's very important to provide this funding so that these public health units can provide the vaccine, which is absolutely free to everybody in the province of Ontario. Anyone who wants to get the vaccine can have the vaccine absolutely free. And that is provided through public health units and various other places where you can get the vaccine. We encourage everyone in the province of Ontario to get vaccinated, particularly if you have fallen behind the schedule as a result of the pandemic. So please get your children vaccinated and get yourselves vaccinated if you have not been vaccinated. You can get a vaccine by contacting your local primary health provider, or you can contact your health unit and they will put you in touch with the source. Thank you, Speaker.
Question. I recognize the Leader of the Third Party.
So government's response so far is, hey guys, everything's fine. I don't think so. You know, the Premier likes to say we're in a war. Well, we were in a war long before Donald Trump got elected. And that war is an anti-vax war. It's the aggressive campaign that permeates the internet and social media, trying to get people not to vaccinate their children. It's well documented that anti-vax campaigns are coming from inside and outside our borders. We all knew this. It's nothing new. It's been going on for a long time. In the pandemic, it intensified. So I don't understand why the Premier failed to act to have Ontario have the best, the most robust information and vaccination campaign in the whole world. I don't know why he doesn't aspire to that. So I'm going to ask again, why is the Premier failing to protect Ontario's children from the measles?